Healthy South Texas is a partnership between the Texas A&M University Health Science Center and Texas A&M AgriLife Extension Service to bring health education, resources, and services to a 27-county region. The Texas A&M University system saw the opportunity to bring our two partners together to address chronic diseases like diabetes. And since 2015, the Texas legislature has supported this unique community-based model that has reached thousands of people.
Our program helps individuals help make better food choices, also to move more, be physically active, as well as self-monitoring. We have a team of individuals that consist of certified diabetes educators, nurses, dietitians, community health workers that work together to help these individuals make lifestyle changes. One of the things that they do is they help them learn how to make better choices in cooking, grocery shopping, as well as how to read labels. In addition to that, they'll teach them different styles of exercise. We also provide them tools that are essential to them, such as a glucose monitor, so they can do their monitoring on their own. We also monitor them every 4 to 8 months. We'll come back and follow up with them to ensure that the goals that they set for themselves, that they're meeting them, and if not, we'll make small changes so that we continue helping them along the way. Because we know diabetes is a lifelong disease, and one of the things that we can do is help support them through this journey.
There's different ways in which we meet people where they are at. For example, we have a mobile health education and outreach unit that we use to go to rural sites that have what we call hard-to-reach populations that really typically do not have access to healthcare services. We also have very flexible locations for service delivery. We partner with community organizations to provide us with space, and we in turn serve the community. So we provide services basically from any area that's close to where people live and congregate. So we work out of churches, we work out of libraries. Community centers are very, very popular because they're easy to get to.
Texas A&M AgriLife Extension Service has a statewide network of subject matter experts and county-based extension agents who bring research-based information and education to communities on topics like agriculture, natural resources, health, and youth development. This reach provides an important local connection for the Healthy South Texas program. Each of the counties in our region is served by an extension agent who works with local coalitions and partners to identify important health needs and then works to deliver programs that reach those topics so that they're relevant to the community and to the people that we serve.
Our community partners are key to the success of Healthy South Texas. They serve as a foundation in which our programs are being offered to the community. The leveraging of resources helps us to be able to expand to more communities. They provide the provision of space, occupancy costs, and the sharing of personnel, which would not be possible to build and expand our programs if we had to do it alone. The selection of locations was based on the need in the communities and also on the availability of resources that partners had to offer. Our goal is to reach the underserved and rural communities, and we looked at our partners in the spaces that were available. One area that we're in is in Nueces County. We're working with the hospital system in their indigent clinics. We're able to provide diabetes education and medication assistance programs to them. Another area is in the Victoria County area with a food bank. We're providing diabetes education and medication assistance services, and they're also providing diabetes-friendly food boxes to our participants as well.
CHW stands for Community Health Workers, also referred to as promotores or promotoras in Spanish. And these are individuals who work with community members to advocate for them, to make community organizations aware of their needs, to identify specific resources for them. And generally, a lot of these individuals are very trusted because many of them come from the communities that they serve, and therefore they have already forged and built trust, which is a very important factor. We address social determinants of health by proactively identifying and addressing health disparities related to culture, language, and socioeconomic factors. As part of our intake process, our staff spend time with our participants to specifically discuss particular challenges and barriers that they face so that we can provide them with adequate resources to help meet some of their needs.
I am proud that Healthy South Texas is responsive to community needs and that we have a process in place to regularly do needs assessments and program reviews with our team, communities, and partners so that we can make sure that Healthy South Texas is meeting the needs of the community and we can continue to grow Healthy South Texas to make lasting impact.